housing ombudsman in England calls to re-establish the link between housing and health. We're going to read into this exclusive from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an exclusive from The Guardian with the headline that housing ombudsman in England have calls to re-establish the link between housing and health. The exclusive reveals that Richard Blakeway says parts of social housing sector have reached breaking point. Guys, while you're here, if you can, hit the like button and share across social media so other people are notified of this video. So I think re-establishing the link between housing and health is really, really important, guys, to tie the two together, because we know that there are a great number of people in England who are unable to work because they're unable to get the healthcare, the treatment that they need, whatever it is that they might be going through, guys. There's lots of different, loads and loads of examples of people up and down across the country who are just not getting the healthcare they need, which means that they're getting stuck in their homes, which means they're not able to pay their bills, which means that or relying on benefits, which benefits, by the way, are really, really crap. And this all spirals into, in your end, and some of them end up in really, really poor accommodation as well. People are living in really, really poor accommodations as well. And that as well, that is bad for people's health as well, because that's only going to make them worse. If you want to so-called build the economy, which we keep hearing all the time from both red and blue, you need to build a workforce, because an economy doesn't work without its workforce, doesn't it? I'm no economics, but I'm sure that if we have people working in this country, surely that helps the economy, does it not? Rather than people who are unable to work because they're not well and they're not able to see their healthcare doctor or whatever it might be, forced to be on absence leave or forced to leave their jobs because of their sickness and whatnot, and they're stuck at home, relying on benefit payments in order to get on by, and their accommodation is not exactly up to standard when they could be working and making a means for themselves instead of relying on the benefit system. Surely there needs to be incentive. We need to incentivize people to get back into work, but we need to do that. We need to be able to have fit and healthy workers to do that as well. So I think you guys see where I'm coming from here. But yes, housing and health, there needs to be that link between the two, because they do go hand in hand, especially in parts of the social housing sector, which we're going to read into here as well. So, like I say, everything all changed. It all ties in together, guys. Economy, health, school, education, all the basic fundamentals of public service. Everything all is chained together, and when multiple systems are failing, everyone suffers as a result. And I think we all know that. The question really is, how do we go about fixing it? And that's something that we will always have a debate on. The housing ombudsman in England are calling for an independent royal commission to reimagine the future of social housing and re-establish the link between housing and health. Richard Blakeway, who handles the thousands of tenants complaining about the mistreatment, disrepair, discrimination and squalor, said that parts of the social housing sector have reached breaking point, with residents desperate and neglected. The system in some areas is really close to being overwhelmed, he told The Guardian. The scale of the challenge hasn't been grasped. About 4 million households live in social housing in England, but 38,000 households are in homes classed as non-decent by the government. About 88,000 households are believed by the regulator of social housing to be living with serious damp and mould problems, which can at worst cause serious illness and death. Blakeway, a former Conservative Deputy Mayor of London under Boris Johnson, has been in his post for more than 4 years, during which time public outrage erupted over the death from mould of a 2-year-old Awwab Ishak in social housing in Rochdale. I can't remember off the top of my head if we covered the story regarding this, but I'm sure we've talked about some cases where have talked about in videos in the past where we talked about some of the most abhorrent of homes for some people, and homes need to be suitable for people. You know, I'm sure some of you guys have even seen videos, documentaries and that from the likes of BBC and Channel 4 of people in really terrible conditions living in such abhorrent homes, and they're trapped in this situation and they have no way out. And there's only one way out, and that is for the government to pull its finger out and do something about it. He said a dramatic growth in casework had turned the ombudsman into something like an emergency service. Blakeway said there had been a neglect in policy, and in some residents have been treated, marginalised and stigmatised by the people that are there to help them. In a 70-page report, he called for a royal commission to present a single view of welfare, health and housing spend. His intervention comes as social housing tenants brace for a rent rise of up to 7.7% in April, after they were capped at 7% in 2023. The Social Housing Action Campaign SHAC group said it was forcing some families in despair and cutting back on heating and food. Some tenants were even quitting their properties and sofa surfing instead, said Susanna Muta, the Secretary of SHAC. We agree with what he is saying, that the whole system needs to be looked at, she said, citing in particular the power imbalance between tenants and landlords that needs to be addressed. On Monday, Macclesfield District Council announced it had launched inspections of 64 council homes after the death of one of its tenants, Jane Bennett, 52, from lung disease likely to have been caused by the mould. The balance is without a doubt out of control between tenants and landlords. Landlords have way too much power. They really, really do. Now, I've seen an argument from some landlords, and I know it wouldn't surprise me if one or two landlords do happen to come across this video as well. So there are some really good landlords out there there are some actual good landlords out there. Yeah, they're not all evil. They're not all bad. Let's be honest. Yeah. There are some who are genuine and not like skyrocketing the prices so that basically destitute people. However, there are those who are ripping the F out of tenants with the intention of milking as much money out of them as possible and kicking them to the curb the earliest convenient possible as well. There needs to be laws and insurances that are in place to stop tenants getting kicked out within 3 months' notice. We know the no faults eviction still hasn't been put through. It's been held still. So that's not a no fault eviction bill. Why are we still waiting for that? I don't know. This story about a person dying in their home because of mould. Who's responsible for that? Is it the council? Is it so there needs to be accountability here. You know, it's not. There's lots of questions again, but not enough answers, and it's so infuriating. These people, we've just read there in it so far. There's already been 2 deaths. Could they have been avoided? What could have been done? What should have been done? These are more questions than answers, and there are people still suffering as of right now as we're talking about this as well. It's just there's times where I just want to scream and shout, and it's just like, well, I could scream and shout, guys, but what's it going to do? Bennett was diagnosed with intestinal pneumonia, apologies for mispronunciation, in April 2023 and was twice admitted to intensive care, but died in June despite treatment with high-flow nasal oxygen, intravenous steroids and antifungals. A pathologist and respiratory consultant were clear that the mould may be causal or contributed to her death. Found Nima Sharma, the coroner, she warned of a risk of future deaths unless Macclesfield Council took action. He confirmed on Monday that it found mould in Bennett's bedroom drawers and wardrobes, but said it made repairs, took a zero-tolerance approach to the fungus, and maintained the home to a good standard. Good standard home, person still died. The last Royal Commission on the Housing of the Working Class was set up in 1884, in which a panel of politicians, trade unionists, business people, bishops, and Charles, the then Prince of Wales, investigated urban and rural slums. It paved the way for mass social housing in Britain and law making landlords personally liable for tenants' health. I think that's something we definitely should be putting in. I'm definitely down for that one. Blakeway wants a new Royal Commission, independent of government and unimpeded by politics, to re-establish housing policy as a health intervention and to create a new long-term plan. It's not one policy, one landlord or one government. It is to blame for the sector problems, he said. It's a culmination impact of poor choices. His intervention is likely to be seen as an implicit criticism of the Conservative record on social housing over close to 14 years in office. His officials have made 14,000 orders and recommendations to social landlords to make things right for tenants since April 2023. The efforts of the combined cost of living and housing crisis has put parts of the sector at breaking point, compounded by narrow vision of what social housing is for. One is which far removed from its conception, Blakeway said. Royal Commissions were common in the decades after the Second World War, but have a mixed impact. According to the Institute of Government think tank, the 1977 Royal Commission on Criminal Procedures influenced the creation of an independent Crown Prosecution Service, but the 1999 Commission on the House of Lords reforms did not deliver change. Social housing tenants are still waiting for the government to deliver on a promise to enforce the so-called Awwab's Law. The 2-year-old died in December 2020, but an 8 weeks consultation was launched only recently. Housing Association said 63% was cut from the government funding in 2010, and since then construction of new homes has fallen while rising demand has been fueled by record private rent increases. Yeah, and since 2010, guys, that's happened. According to the latest English housing survey, 380,000 households live in social housing that is rated non-decent. Blakeway said the figures were probably a gross underestimate. He said that there was an emphatic case for government action and resources to support local landlords as the status quo was not sustainable. Kate Henderson, the chief executive of the National Housing Federation, which represents social landlords, said it was pleased Blakeway had added his voice to growing calls on the government to invest in social housing. The system is under immense pressure, she said. We are calling for a long-term plan which delivers more social homes and provides funding for regeneration. The government said it was taking action to improve the quality of social housing and give tenants a proper voice, including through the Social Housing Regulation Act 2023. Spokesperson for the Department Levelling Up Housing and Community said, tragic cases such as Awwab's Ishak must never happen again. That's why we've introduced Awwab's Law to force social landlords to address hazards such as damp mould within strict time frames. Landlords must consider the ombudsman report carefully and ensure that they take the needs of vulnerable residents into account. I've said before, guys, about how politicians and people with power only act when people die. They only act when people start dying. Too many times, it's always the case of people need to die for politicians to take something seriously, and it's not right. It infuriates me. Why do we always have this situation where somebody needs to die for people to wake up and realise that, oh, we need to do something about this? I just don't understand why we have this mindset as human beings. Well, I'll take that back. Not mindset as human beings. Mindsets in, let's say, people in politics. I mean, that's the way it is, isn't it? You need someone to die for people to stand up and pay attention nowadays. Too many times this has happened. So, what do I think about Richard Blakeway's some of his points? I think they're really, really good. If I'm honest, guys, I really like some of his points. He's saying it's obviously not exclusively the government. It's lots of choices, and I tend to agree. I don't think it's 100% on the Conservative government, but they have played a major factor in what's happened in the last 14 years. There's no denying that. Have there been mistakes by councils as well, potentially as well? Has the treatment of landlords on tenants been fair? No, I don't think so. The vast majority of landlords have not treated their tenants very well, and the laws have been very loosened for them, allowing them to treat them unfairly as well. And I think that's played a part in it as well. What doesn't help is that landlords have a connection with the Conservative government, because quite a lot of Conservatives are landlords themselves. Conservative MPs are landlords themselves, and that does not help the situation either. So the balance is already the balance is not fair just on that alone. But I like a lot of Richard's ideas. Whether or not a royal commission will be implemented, I don't know, but we'll have to wait and see on that, guys. So what do you guys think? What do you guys make of the re-establishing a link between housing and health? What do you make of Richard Blakeway's and some of his ideas? A royal commission, what are your thoughts on that? Should that be something? Is the government to blame for this? Is it councils? Is it landlords? What do you think? Let me know what your thoughts are in the comments section down below. If you can, hit the like button, be greatly appreciated. Share this across social media and hit that bell notification icon so you'll be notified when I upload another video. And if you want to financially support me, you can do so by joining YouTube membership for just as little as 99p or joining me on Patreon for exclusive content. Thanks so much for watching, guys, and I hope to catch you all very, very soon.